Hi, my name is Alexis Oxolio and I'm a nurse. I'm 30 years old and I currently live in Anaheim, California. I'm an LVN, which is also known as a licensed vocational nurse. I've been a nurse for about 7 years now, and I've worked in pediatrics with traumatic brain injury patients, anywhere from infants all the way to 21 years old. I've worked with patients who were near drowners, car accidents, any kind of traumatic brain injury. I worked at acute rehabilitation center for that. And after that, I came to Kaiser Permanente, which is where I am now, but I started off in pediatrics. And then I moved to OBGYN, and now I'm currently in general surgery. I currently study at National University. I'm taking my prerequisite classes to hopefully get into the LVN to Bachelor's of Science in Nursing program next February. And then after that, I want to pursue my master's degree, and I want to become a certified registered nurse anesthetist. I became a nurse because I've always had a strong passion to help people. And I think what really did it for me was when I was straight out of high school, and my mom was diagnosed with terminal cancer of the liver, lung, and pancreas. She immediately went into hospice, and I pretty much took care of her in her last days from then on. And even though it was one of the most difficult experiences of my life, it also made me stronger than I ever thought I could be, and that's when I knew I was meant to be a nurse. To be a nurse for me means to have unending compassion, empathy, and unwavering kindness. And you have to have a really strong heart, because what we do every day, the patients that we deal with, the diagnoses that patients end up having, you have to have the compassion and the kindness, but at the same time you have to just have a really strong heart, because you can't just lose it in front of a patient and their families. They have to know that you're there to care for them, but they also have to know that you're there to support them. And that's where the strong heart comes in. Being a nurse also means missing out on a lot of holidays with family and friends and special events with loved ones. But at the end of the day, there's nothing better than feeling that fulfillment of being a nurse, because in some way that you've helped save a life. I believe that I'm an awesome nurse because for me, being a nurse isn't just a job. It's not something that ends when I clock out at the end of the day. It's a passion that I carry with me everywhere I go, because I love taking care of people, whether it be physically, emotionally, or mentally. And all of these reasons are why I believe anyone is an awesome nurse, and if you have that, then that's what it is to be a nurse, and I am a nurse. Thank you.